It's 2021. While we've come a long way since Kawasaki disease was first discovered in January of 1961, there's still a lot we do not know about the disease, such as its exact causes, triggers, or genetic predisposition. Kawasaki disease is the #1 cause of acquired heart disease in the US. Although its cause is unknown, it is primarily thought to be an infection or an abnormal immune system response to an infection. It primarily occurs in children ages 5 years and younger. It involves a set of clinical features and high fever. However, incomplete or atypical KD may not have all of these features and should not be completely ruled out. In order to better understand KD and its history, we must go back to the year 1961. Dr. Tomisaku Kawasaki of Japan saw his first patient with the telltale signs of what would later be named Kawasaki disease. He would later describe the cases as infants with persistent fever, rash, swollen lymph nodes, swollen and peeling hands and feet, red eyes, and strawberry tongue. On this historic day of January 26th, Dr. Kawasaki saw his first case of KD. Unfortunately, that wasn't the last, and since then, tens of thousands of other children have gotten the disease. That is why we want to raise awareness for Kawasaki disease. And now, January 26th has been designated Kawasaki Disease Awareness Day, so we can all honor Dr. Kawasaki's legacy and continue to raise awareness for Kawasaki disease. In the 1970s, Kawasaki disease emerged in the United States. What we now know as KD was being noticed in Hawaii at the same time that it was being described in Japan. In the early 1970s, 2 young faculty members in the Department of Pediatrics at the University of Hawaii began to see children with an unusual constellation of fever, rash, and other KD signs. In addition, in 1976, Dr. Kawasaki published the first English language report of 50 patients with Kawasaki disease. In the spring of 1998, the Kawasaki Disease Research Program at the University of California, San Diego School of Medicine initiated a medical historical investigation of KD. This was in order to widen research questions related to the etiology or cause of the disease. Investigators collected a variety of data, including historical records of clinical cases and autopsy reports. Even today, the Kawasaki Disease Research Center is continuing research to identify the causes of Kawasaki disease, and more recently, how it is related to MIS-C. By 2003, investigators in the Kawasaki Disease Foundation, which is a national parents group led by Greg Chin in Massachusetts, applied for and were awarded a 3-year National Library of Medicine grant to develop a website and produce a film on the history of Kawasaki disease. Since then, the Kawasaki Disease Foundation has donated over $500,000 to further Kawasaki disease research, and also has supported thousands of Kawasaki disease families in raising awareness and providing support. Despite the significant progress that has been made, researchers are still attempting to uncover the specific cause and etiology of Kawasaki disease. In addition, there is no specific diagnostic test for Kawasaki disease, and clinicians must carefully exclude out similar lookalikes to Kawasaki disease. This is why raising awareness is so important in order to help others recognize the signs of Kawasaki disease and help them get a timely diagnosis. National KD Awareness Day is January 26th. By setting up a KD fundraiser, you can raise awareness of KD among your friends and family. Tell them why you want to share your KD story, and most importantly, why raising awareness of KD is important to a timely diagnosis. In addition, follow KDF Youth and KD Foundation on Instagram to win giveaways such as this teddy bear or a shirt. Thank you so much.